Hello, I am Dr. Mark Hutchinson from the University of Illinois in Chicago in the United States of America.
大家好，我是马克哈钦森博士，我是来自于骨科及运动医学科的这个伊利诺大学芝加哥分校的一个医学教授。
I am a professor of orthopedics and sports medicine. I serve as the head team physician of all sports at the university.
我是一个骨科及运动医学科相关的教授。
I've also been one of the founding educators in arthroscopy for the Arthroscopy Association of North America.
我同时是一个这个相关的这些运动学的一个支持者，一个提供者。
And it's really from that knowledge that I'm going to share with you some thoughts regarding the meniscus in the knee.
今天我们来分享一下相关的这个半月板相关的这个知识。
And as we walk through this talk, we're going to talk about some of the anatomy, but we're going to talk about old-fashioned treatment, new ways of treatment, and how far has the pendulum swung in treatment.
那么今天呢，我们讨论半月板，我们会讲一些解剖相关的知识，我们会讲一些传统的治疗，一些进阶的治疗，以及我们目前的这些所有的行为是如何在这些传统和新进展之间摇摆的，像钟摆一样。
Regarding disclosures, I receive no corporate support, although the university sometimes gets some educational support for the residents.
我这里有一个公开声明，就是我这里没有任何的企业赞助和支持，只有一些相关的这个教育和研究的支持。
I do serve on the editorial boards of a variety of journals, including the American Journal of Sports Medicine, British Journal of Sports Medicine, Medicine Science and Sports Exercise, and the Clinical Sports Medicine.
我这里有一些这个编委，我参加了一些编委会，包括美国运动医学杂志，英国不列颠运动医学杂志，还有一些临床运动医学，还有一些这些内科学与运动医学，还有一些相关的其他机构。
So as we walk through, I want you to think about how the knowledge is developed and how we come to challenge knowledge to become aware of new opportunities.
好，那么在开始我们课程之前呢，我想让大家去思考一下我们的这个知识是如何出现的，以及我们的新的知识是如何去挑战旧的知识的。
We generally begin with foundational knowledge, and then somebody has an innovative thought.
首先，我们可能是会有一个基础的知识，然后某些人可能会产生一些创新的想法。
This is usually supported by small stories or anecdotal support.
这些理念有可能会被一些坊间的传说或者是一些人支持。
And sometimes this becomes common acceptance or dogma without good scientific evidence.
有时候这可能并没有科学的证据，但他们会变成一些被人们广泛接受的共识。
And then as time passes, someone challenges it and chooses to see if it's actually true or false by doing experimental testing.
随着时间的推移呢，会有一些人这个通过实验证据去质疑这些认知。
And then beyond experimental testing in the lab, once that idea or that knowledge is considered valid in the lab, we look at the big picture and actually assess the outcomes in patients.
就一旦这些证据，一旦这些观点，他们被实验室的证据所证实了，那么他们可能会有一些进一步的这个意义。
But sometimes, after even we thought we knew the answer, we have to re-challenge ourselves and reassess what we thought was dogma to come up with new ideas and innovations.
有些时候，即便我们这个观点已经被证实了，我们还是需要去重新审视去持续评估我们的这个观点。
So it's this thought pattern I'm going to walk you through regarding meniscus in terms of foundational thought to actually the newest ideas in meniscus treatment.
所以这样一套过程呢，我们可以用它来去考虑我们的半月板损伤相关的基础知识以及一些新的认知。
So, foundational knowledge with the meniscus. It comes from the Greek, which means lunar crescent.
好，那么我们所知道的这个基础知识半月板它这个词的词根呢，来自于希腊语，指的是新月。
It's made up of type 1 fiber cartilage.
它是由这个一型的纤维软骨构成的。
It has a relatively low content of water.
它含水量很少。
And it gets its nutrition either from the periphery or through diffusion from the synovial fluid.
它只能通过外周的一些浸润获得营养。
In terms of its infrastructure, we have to think that form follows function.
好，那么我们去看它的这个进一步的结构，我们需要考虑它的结构决定了它什么样的功能。
It is a wedge-shaped structure that serves as a secondary stabilizer, which breaks the movement of the femoral condyle front to back.
它是一个这个楔形的一个结构，那么它是一个刺激的一个稳定器。
The surface of the meniscus actually has random collagen fibers that resist shear stresses.
那么在这个半月板的表面呢，它其实是一些这个随机的胶原纤维组成的网状结构，可以抵抗剪切力。
They also have some radial tie fibers, which actually connect the meniscus to the periphery.
它里面还有一些放射状的这个纤维，它们可以把这个半月板跟其他外周的周围的组织连接。
But most of the meniscus are made up of circumferential collagen fibers that wrap around in a circle and resist hoop stresses.
那么在这个半月板里呢，还有一些环状放射的这个胶原纤维，它们可以抵抗环向的一些压力。
You'll want to remember these collagen circumferential fibers because when we think about meniscus repairs, this is the area that we need to target.
那么讲这个的重点在于，当我们去考虑到半月板的恢复和修复的时候呢，这些结构是恢复的重点。
In fact, the circumferential fibers attach to the periphery, but also are anchored centrally to the roots. And we need these roots need to be functional for the whole circumferential fiber to be working.
那么在我们半月板的两边呢，我们称之为叫做半月板的根部。这个根部呢是固定这些所有的圆周向放射的这个纤维的一个锚点那么它是我们修复的一个重点。
The lateral meniscus tends to be more mobile than the medial meniscus.
外侧的半月板呢，它会相对来说更加具有活动性，相对于内侧半月板来说。
And the shape of the meniscus serves to match the round femoral condyle to the flat tibia.
那么我们的这个圆形的这些软骨呢，它们是与我们的胫骨平台相匹配的。胫骨的上面一段是平的，所以我们叫胫骨平台。
An intact meniscus is very, very important because an intact meniscus increases the contact surface area of the condyle and the tibia by 10 times.
那么半月板的存在是非常重要的，因为它可以增加10倍的我们的胫骨与腓骨的接触面积。
When you lose the meniscus, you get focal pressures that have almost 3 times the load in a very focal spot on the tibia and the femur.
当这个半月板缺失的时候呢，我们的这个胫骨腓骨接触的这个焦点压力会上升3倍。
And it's these focal loads that end up leading to arthritis.
然后这样的压力的上升呢，可能会引起这个关节炎。
So I actually like to teach my patients about this focal loading compared to diffuse loading with an intact meniscus.
那么我通常跟我的患者沟通的时候呢，会习惯于这么去告诉他们这样的压力变化。如果没有半月板的话，压力可能会相对来说更大一些。
And I'll demonstrate this in the office by simply cupping my hand.
那么我会向我的患者显示他的压力变化呢，像这个样子。
And describe to the patient that my cupped hand is my tibial plateau with a good meniscus.
那么我会向我的这个客户讲，我的骨头像我的手一样保持这个状态。
I'll then take my other hand and nestle it into my palm.
那么我会把我的另外一只手呢，假装成我的这个腓骨啊，胫骨啊，腓骨指向我的这个手掌啊，不是股骨啊，上面那个手是股骨指向我的下面作为手掌的这个腓骨。
And since the shapes match, it's actually quite comfortable.
那么如果它的这个表面积非常的吻合呢，你就会觉得很舒服。
And then I'll flatten out my hand to represent a tibial plateau with no meniscus.
那么我现在就会把我的一个手指这个伸出来啊，模拟这个没有这个半月板的一个胫骨平台的一个状态。
And then I'll lean my hand into that palm and they can feel that focal load, which represents the loss of meniscus and the load you get that can lead to arthritis.
然后这个时候呢，我们就可以感受到下面这个手掌，这个假装胫骨平台这个手掌上面的这个核心的压力的变化。这时候我们就可以感知到为什么会出现关节的炎症。
This is a very interesting thing that we've learned about the meniscus, and it was actually a lucky picture discovered by Steve Arnowski.
这个其实是一个有关于半月板的非常有意思的一个非常幸运的发现。
They actually were studying the ACL and then went back and looked at the slides where they had cuts of the meniscus.
它其实是起自于我们的这个前交叉韧带。
And what we can see is, here's the femoral condyle, here's the tibial plateau, this is the meniscus.
我们其实可以看到，上面是我们的这个股骨的软骨，股骨的远端的软骨，而下面是我们的这个胫骨平台，而中间呢是我们的这个半月板。
And this is the vascular circulation to the meniscus that comes to the peripheral third.
那么这里面这些黑色的呢，是这个半月板相关的一些微动脉、微血管。
This is very, very important because it's the peripheral third, where the vascularity is, that's possibly repairable.
那么这个非常重要的意义是什么呢？是这个外周的这个1/3的半月板啊，它们是有血供的，它是可以修复的。
Any tears in the non-vascular area will not heal.
但是这中间的这些没有血管的区域呢，是无法修复的。
We have to pay attention surgically that around the knee there are other structures that might be at risk.
我们必须要注意啊，当我们做这个手术的时候呢，在膝关节周围的一些结构可能会有些风险。
And so if we perform a repair, we have to look out for the saphenous nerve medially, the peroneal nerve laterally, the popliteal artery posteriorly.
那么我们需要去注意，在这个膝关节内侧、外侧、前侧、后侧的各种神经和动脉的一些损伤风险。
Now, historically, a long time ago, people felt that the meniscus was vestigial or unnecessary.
那么在曾经的理论当中呢，人们认为这个半月板啊，它是一定会被磨损，且并不是必要的。
And in fact, it was very common to resect the entire meniscus.
那么在那个时候呢，大家可能经常会发现一些人没有了这个半月板。
So one of the first foundational challenges of thought was done by Dr. Fairbanks, who said we need to save the meniscus because loss of meniscus almost always led to arthritis.
那么 这个时候呢，一位教授吧，他就提出了这个不同的意见，他认为我们需要去拯救我们的半月板啊，因为如果没有半月板呢，很多人可能会出现膝关节的炎症，关节炎。
Indeed, it's the only thing I guarantee in orthopedics that if you lose your meniscus, you will get arthritis within 10 years.
那么我们现在非常确定的是，如果你没有了半月板，你会在10年之内罹患膝关节炎。
So this discovery led to a practice change that led everyone to begin to try to save the meniscus.
那么这样的一个实践呢，这样的一个结论呢，导致了我们的一些做法的改变。我们现在要去拯救半月板。
So I have a couple of different case challenges, and I would ask you to think for a second where you are on the pendulum.
那么我这里有一些案例，我希望大家去思考一下。那么你现在是在哪一个角度去解决问题？
So for a 12-year-old female basketball player or soccer player who has an unstable knee and has a peripheral meniscus tear, what would your choice of treatment be?
那么我们这里有一个12岁的女性的篮球或者足球运动员，那么她现在有一个不太稳定的膝关节，并且呢，她会伴有一个外侧半月板外周的一个半月板内侧的一个撕裂。那么现在你觉得她应该怎么去解决她的问题？
Would you wait for skeletal maturity? Would you perform a meniscus repair? Would you take out the torn meniscus? Or would you fix the ACL and repair the meniscus?
那么你会等到这个孩子的骨骼发育成熟吗？你会为他做半月板的修复吗？你会直接给他做半月板切除术吗？还是会做一个前交叉韧带加半月板的一个操作？
Let's walk through some of the evidence to see what the best answer would be.
那么我们来看一下证据是怎么说的。
This is this young lady, and you can see that for us, she had the peripheral meniscus tear, which was repaired, and she had an ACL surgery simultaneously to stabilize the knee.
我们可以从这个影像上看到，这是这个女孩的这个膝关节，那么她有一些这个半月板外周的一些损伤，同时她还会有这个前交叉韧带的损伤。
This is a study by Dr. Kreisch, who basically showed that without stabilization, i.e., should you fix the ACL and the meniscus at the same time? Without stabilization, they had much higher failure rate of the meniscus. With stabilization and an ACL reconstruction simultaneously, the meniscus had a better chance of being saved.
那么这是一项这个某位教授提供的研究结论，它就显示呢，如果有了这个前交叉韧带，有了半月板，有更稳定的话，他们的最终的结果呢会更好一些。啊，如果没有呢，那么稳定性会更差，他们最终结果会更差一些。
In their study, they also noted that they had better outcomes, more success of meniscus repairs if the tear was within 3 millimeters of the rim, which was that vascular area.
那么如果我们的这个外周的这个环呢，它如果小于3毫米的话，那么它们最终的修复会更好一些。这里可能是这个血管所在的位置。
And then they also found that simple tears or bucket tears did better than complex tears that were ripped in various directions.
那么简单的一些撕裂的状态呢，也会更容易修复一些，相对于复杂的这个撕裂。
This is actually a study from the American Academy of Orthopedic Surgeons that did a comparison of just meniscus repairs or meniscus repairs with reconstruction.
这是一项这个来自于美国骨科手术医师学院的杂志的这么一篇论文。
The yellow colors represent isolated meniscus repairs, and the success is somewhere between 50 to 75% success rate for just doing a meniscus repair.
那么这里面黄色的图标呢，显示了这些单独做了半月板修复术的这些人，他们的一些恢复的比率，基本上是在50%到70%几之间。
but the success rate of the meniscus repair jumps up to 93 to 95% if you stabilize the knee at the same time.
那么，如果我们在修复半月板的同时呢，做了膝关节的稳定的修复呢，它的这个恢复比率会上升到90%以上。
Now, this is a study that actually says if you actually stabilize the knee, will you actually prevent future meniscus injuries?
那么这样的实验就告诉我们，如果你做了膝关节的稳定，也就是前叉韧带的重建呢，那么可以更好的在未来这个降低我们膝关节的一些疾病的风险。
And what they discovered is that treating an ACL injury non-operatively at a 5 times risk of developing meniscus injuries over time.
那么，如果我们不进行手术去恢复这个前叉韧带，通过这个非手术治疗去稳定膝关节的话呢，那么出现半月板撕裂的风险会上升5倍。
In addition, untreated ACLs had a 6-time risk of developing osteoarthritis.
那么，如果我们没有进行这个手术治疗前叉韧带的一些这个损伤呢，很可能会出现6倍的关节炎风险。
With 16 times risk of ultimately requiring a total knee arthroplasty.
那么非手术组呢，他们还会有16倍的这个风险，最终会进行全膝关节置换手术。
From the meniscus perspective, it's really quite clear that stabilizing the knee prevents future, for active twisting and cutting athletes, prevents future meniscus injuries.
那么，所以说目前现在来看呢，这个从这个半月板的角度来讲，膝关节的稳定对于未来的预后非常重要。ACL 的重建呢，可以很好的预防未来的一些关节的炎症。
So the current state of the pendulum for acute tears in athletes: save the meniscus, stabilize the knee.
所以我们的钟摆呢，现在又摆到了另一边。我们目前的治疗的原则是保护我们的半月板，保护我们的膝盖，稳定我们的膝盖。
Now, there are different types of meniscus tears, and the different types are going to guide us whether they're classically treated with meniscectomy or resection or repair.
那么这里是常见的半月板的撕裂的一个分类。那么不同这个分类呢，可以指导我们进行不同的操作。那么有一些可能要进行半月板的切除，有一些可以进行一些传统的治疗。
And the classic repairable ones are the ones that have a vertical tear around the periphery, around that vascular zone.
那么这里提示了几种可以修复的，比如第一种是它是一种纵向的一种撕裂，然后呢，它外周这些有血供的区域呢是完整的。
Flap tears and radial tears tend not to be as repairable.
那么这个平的撕裂和这个放射状的撕裂呢，很难去修复。
So when we treat a meniscus that has to have a resection, our guiding rule is to remove the least amount of tissue possible.
当我们去做半月板切除的时候呢，那么我们需要尽可能少的切除组织。
We want to leave a balanced, stable rim so that more tearing won't occur.
那么我们希望能够去留下一些均衡的、稳定的这个边缘，帮助它的恢复。
And we want to leave as much good meniscus that hopefully will still function to share the load.
那么我们希望尽可能多的留下这些好的半月板，能够帮它更好的分担压力。
So classically, here as you can see, with a tear like this flap tear, we would resect or saucerize to shape it like a meniscus so that we take out the bad part but leave the good part so there wouldn't be more tearing.
那么这几张图呢，给我们显示了我们常见的切除的方法。我们会这个把不好的组织切掉，尽量留下好的组织。
If we can repair the meniscus, we're going to put sutures in, and when we put the sutures in, ideally we want to diverge the sutures so that the ends of the meniscus tear sit next to each other to heal.
那么当我们可以去修复半月板的时候呢，我们会去缝合半月板。 那么我们希望呢是进行一些发散性的缝合，避免呢去点状缝合。
Divergent sutures, ones that spread out, are more likely to do that. Where if we put our sutures too close together, we get a spot weld, which is not as good of a repair.
那么我们希望像这个下图一样去发散性的缝合呢，这样会好一些，而不希望我们的缝针呢相距太近，这样就会像上面一样达不到一个好的效果。
In terms of suture technique, a vertical mattress suture, where the suture is oriented up and down, is better than a horizontal mattress suture, where the suture is oriented side to side.
那么这里讲了一个外科缝合的术语，叫做入式缝合，就是我们在缝合的两边呢，都要把这个线啊再次埋进这个组织，然后垂直呢就是对着这个伤口的，而水平呢是平行于伤口的。这里会讲这个垂直的这个入式缝合呢，效果会更好一些。
And the reason that it's stronger is that the vertical mattress is encompassing more of those circumferential fibers we learned about in terms of basic structural anatomy of the meniscus.
这里垂直入式缝合会更好，就是因为跟我们刚才讲过的一些解剖知识啊，跟这个像周围放射这个这个纤维呢，它们这个结构会更加吻合一些。
Virtually, we need to have that meniscus and the peripheral vascularity. We need blood to allow the healing to occur.
那么想要去增加我们的修复的效果呢，我们需要更多的血液供应。
Occasionally, what we will do during the surgery is find ways to improve or increase bleeding to increase the healing.
那么偶尔呢，我们在手术当中会去寻找更多的血液供应，来帮助他们获得更好的这个恢复。
And we can do that by putting a shaver at the outside edge. We can put in PRP or a blood clot. We can poke holes through the meniscus, or actually poke holes into the bone.
我们可以做一些操作，我们可以去用一些这个专门的纤维蛋白凝块啊、PRP 啊这些操作去增加它的血液供应。
And so then when it comes time to do the actual repair, we have various techniques, and I'm going to quickly show you a few of the techniques that we use.
当我们真正的去修复半月板的时候呢，我们会用到非常多精密的这些技术，我会快速的去展现一下这些技术。
We do inside out repairs with these cannulated guides that help us aim a long needle to poke those sutures through the meniscus.
我们会用到这些类似于导管的器械呢，来帮我们去引导这个针的这个方向。
And we can do lateral meniscus repairs.
我们可以去做这个外侧的这个半月板修复。
When we do the meniscus repairs, we want to put the knee in extension so that we actually don't grab capsule, so that it doesn't make the knee stiff afterwards.
那么我们在做手术的时候，我们希望这个膝关节是伸展的，这样的话不会产生这个关节囊，这样的话在手术之后呢，关节不会僵硬。
Another technique that we use is an outside-in technique, which now instead of using those needles through the joint, we actually begin outside with small needles to advance sutures through the meniscus.
那么这里又讲了另外一个技术，叫做外内技术啊，他们通过这个两根针来完成这个手术。
So we would poke the needles through the meniscus, retrieve them through the cannula, tie a knot, and then pull it back to tie it back on the outside.
那么我们把这个针头呢，指向半月板，然后呢再把它们再拉回来啊，这样一个技术。
More commonly now in modern days, we actually have third generation meniscus repairs that we can repair these all inside using the arthroscope only.
那么我们现在呢进入到了这个第三代的这个修复啊，现在我们主要也用第三代。那么这一代呢，我们就只需要进行关节镜下的修复了，就不用去把膝关节打开了。
To be as good as the other techniques, we need them to be simple and efficient, safe, as strong as inside-out repairs, reproducible, and have leave minimal material within the joint, and allow vertical matrices.
那么虽然说我们用了这个叫关节镜啊，就是微创的技术，但微创的技术呢，应该跟之前的手术具有同样的一些效果，或者至少应该是简单有效的、安全的。然后像之前这个手术一样是坚固的、可重复进行的。在关节内用的材料应该是尽量的少啊。
And so here you can see an example of one, and this is done all with an arthroscope. They can have PLLA, peak anchors, or all suture anchors.
好，大家可以看到这个影像，这是一个关节镜的一个手术操作图。那么它用了一些这个生物材料的一些毛针啊，可以帮助我们非常简单的在这个非常微小的环境下进行手术。
These are entered into the knee joint through an arthroscopic portal. You poke through, deploy the anchors, and then tie the new and then the suture ties itself.
OK， 那么这是在关节镜下呢，我们去进入到我们的膝关节啊，然后去进行这样的操作，放置我们的这个缝合针，然后它们自动会进行这个所有的这个缝合。
So here you can see the sequence again. First, you penetrate the meniscus.
这里你可以看到所有的步骤啊，再次看到，我们首先要穿透这个半月板。
With each of the anchors.
然后放置我们的锚点。
And then the anchor is deployed.
然后这个锚点就可以被放置了。
Now, so those are ones that actually we commonly will do, which would be a longitudinal or a bucket handle tear. Those are common ones that we would normally consider repairable.
那么这里面我们可以看到，这种长形的和这个像这个腰带扣一样的这种损伤呢，是可以被修复的。
Until probably the last 5 or 10 years, we didn't have the technology to be able to fix a radial tear or a root tear or a horizontal tear.
那么，但是在5年之前呢，我们是没有任何办法去修复这种放射性的根部损伤的，以及这种水平撕裂伤的这种半月板损伤的。
But if saving the meniscus is very important, then we shouldn't limit ourselves to just saving these. We should try to be able to save all types of tears.
那么对于我们来说，重要的是呢，不是说只是修复某几种类型的半月板损伤，我们应该是要去尝试修复所有类型的半月板损伤。
So more recently, the pendulum has been challenged again of what is repairable.
那么最近呢，我们这个知识的钟摆又被挑战了。最近认为我们应该去修复所有这种形式的半月板损伤。
And so you can see in this arthroscopic image a radial meniscus tear.
那么大家可以看到，这是一个关节镜的一个照片啊，就是在关节镜做微创手术的这个视频。那么这是一个放射状的一个撕裂。
Normally, which historically we would have said had to be resected, we wouldn't try to fix it.
那么我们这时候再进行一些这个切除的操作，然后我们去尽量去修复它。
However, these two studies, one by Zhang and one by Leprade.
那么但是呢，这些研究呢，它是一些研究是被这个张这个研究者提供的，还有一个叫做 Leprade 这个研究者提供的。
Have actually demonstrated that at time zero, when the meniscus is repaired, the joint contact forces have actually been able to be returned to normal.
那么他们的研究显示了呢，就是在这个半月板修复之后，在同一时间，他们膝关节的压力就恢复到了正常。
Now, we need to have future randomized control studies to find out whether this repair at time zero will last.
那么我们在之后呢，需要进行更多的随机对照研究，去确保他们这样的修复呢，能够持续多久，效果能持续多久。
But certainly saving the meniscus and trying to save the meniscus is going to be very important.
那么当然不可置疑的是，修复半月板啊，以及去尝试修复半月板一定是很重要的。
A different type of meniscus tear is a horizontal degenerative cleavage tear.
好，那么这里还有另外一种不同的呢，是这个水平的半月板撕裂。
Again, classically a tear that we simply would have debrided and taken out.
那么同样呢，这个传统的治疗方法呢，就是我们不会去修复它，只会把它去拿掉啊，切除。
However, recent studies have actually suggested that we can improve the contact forces. And here's a second look arthroscopy showing a nice repair of a horizontal cleavage tear.
那么新的研究显示呢，如果我们去修复这个半月板呢，会有进一步好的效果。那么这个视频呢是在一个关节镜下进行的修复操作。
So we shouldn't limit ourselves to what we thought we used to be able to repair. More and more of these tears may be savable.
那么对于我们来说，重要的是我们需要去尝试着去进行一些新的操作。这样的话，越来越多的半月板撕裂的形式都可以被进行修复了。
This is just another device that allows various types of repairs.
这是另外一个手术器械啊，它可以帮助我们去进行一些不同的修复。
And more companies are coming out with other technologies that will assist us in accomplishing these challenges.
那么越来越多的公司呢，也开始进行了一些不同的尝试啊，他们可以帮助更多的损伤修复。
Now we've talked about the radial tears and the horizontal tears. Another type of tear is the root, the actual anchor of the meniscus into the central part of the tibia, or the tibial plateau.
那么我们刚才讨论了这个水平的和这个放射性的撕裂，现在这里讨论另外一种叫做根部撕裂。那么根部呢是半月板附着在骨骼上的一个锚点。
And what we know is that a complete root tear absolutely works like a complete meniscectomy, which means they're doomed to get arthritis within 10 years.
那么如果我们进行了一些如果是根部完全撕裂的话，那么他们如果不进行任何手术，他们会出现一些严重的关节的炎症。
But this study actually shows very positive outcomes with actually 82% that did not show degeneration at 3 years when they had a root repair.
那么这样一个研究呢，就显示了一些非常积极的效果啊，就说他们进行了这个半月板的修复之后呢，82%的人没有出现退行性变，就关节的退化。
So once again, saving the meniscus is actually very important.
那么我们再要强调一遍，那么保护半月板其实是非常重要的。
And here's just one of the tools that we can use to attach suture to the meniscus to repair it.
这是另外一种我们可以用来缝合半月板的一个工具。
Now, another challenge that I personally have wondered about is why is it that with ACL, even reconstructions, do we have a high risk of getting arthritis in the knees?
那么这里有个问题啊，也是我个人非常感兴趣的问题，那就是即便我们做了前交叉韧带的重建术，那么还是会有很多人会这个得关节炎症。
Indeed, Rob Laprade showed that at 5 years after an ACL reconstruction, there's 11% risk of getting arthritis. At 10 years, there's 21%, and at 20 years, there's 52% risk of getting arthritis.
那么这里有一位研究者提供的研究数据呢，显示，即便是做了前交叉韧带的重建术之后呢，5年患关节炎的风险在11%，10年在21%，20年呢在52%。
And I believe it's because the footprint of the ACL is very close to the meniscus roots.
那么可能是因为前交叉韧带呢，它离这个半月板的根部啊非常的近。
And when we do an ACL reconstruction, we may be damaging the roots, or a PCL reconstruction, we may be damaging the posterior roots.
那么当我们在做这个前交叉或者后交叉韧带的重建术的时候呢，我们可能损伤到了它半月板的这个根部。
So here you can see the potential contact areas of the root anatomy. and how close it gets to the ACL and the PCL.
那么我们可以看到呢，当我们在做一些这个切除术的时候，很可能会损伤到这里。
So this is actually the evidence of that. The first study is one that I did with one of my residents and Rob Laprade, and we actually assessed how much meniscus damage occurred with a normal ACL.
OK， 那么这篇研究呢，是我和我的团队，我的住院医师Laprade 我们一起做的这个研究，我们首次评估了这些相关的易源性损伤。
And what we found is that the lateral root could be injured in almost in 66% of the knees.
那我们看到了这个外侧的半月板呢，它们大概有这个66%的损伤的概率。
And if the angle of the tunnel was placed at 40 degrees, you had a partial injury to the medial root in about half the knees.
那么如果我们把这个角度啊，内侧根部的角度调整到40度呢，那大约有一半的半月板会有损伤。
Laprade followed that up, suggesting the same type of a risk of damage with PCL reconstructions and IM rotting.
那么这个我这个住院医师呢，他进一步完善了这个实验呢，去关注后胄下韧带和这个一些别的操作，他们对于膝关节的损伤。
In fact, more recently, a different resident of mine, what we've done is we've started actually repairing the anterior root at the time of the ACL reconstruction and found that it actually improved the stability of the anterior horn of the meniscus.
那么最近呢，我另一位住院医师，他做了进一步的实验啊，他认为呢，这个前脚的修复可能对于这个最终的恢复是有帮助的。
So, those are the types of things that we look at in terms of repairable meniscus. The next foundational challenge of meniscus thought has been of how we take care of degenerative meniscus tears.
那么刚才我们讲了这个半月板的修复呢，那么进一步呢，我们要考虑这个半月板的一些退行性疾病的时候，我们该怎么去操作？
So I'm going to give you 3 case challenges to think about, and then we're going to talk about the evidence of outcomes of treatment of degenerative meniscus tears.
那么这里我会提供3个不同的案例，大家来思考一下。那么我们该如何进行这个操作来预防关节的退行性疾病？
So the first question is, what would you do about a 40-year-old female triathlete with medial joint line pain, no clicking, a complex meniscus tear, but no arthritis?
那么如果我们的客户是一个40岁的女性的铁人3项运动员，她的内侧的关节啊会呈线性的疼痛，没有弹响。那么它的影像学显示呢，它有一个复杂的内侧半月板的撕裂啊，但是呢，它在这个站立的 X 线上呢没有显示有关节病的症状。
Does she get physical therapy, a resection, or do you try to repair it?
那么它应该是进行物理治疗呢，是进行切除术呢，还是进行修复术呢？
And does that change? Does your idea change of how you want to treat her if instead of having no clicking, now she has a locking sensation within her knee where her knee gets stuck?
那么如果这个同样的这个女性客户啊，那么她现在是有这个绞索感，就是类似于卡压的感觉，那么我们的操作应该是什么？
Or a different patient, a 48-year-old male who has a little bit of arthritis on x-rays, no mechanical symptoms, and a painful McMurray's examination. Do you treat him with physical therapy, resection, or repair?
OK， 那么如果是另外一个客户，他有这个内侧的关节的疼痛，然后呢，但是他没有一些这个机械型的症状，那么影像学显示呢，它会出现一些关节间隙的相对的变化啊，以及半月板的变性。那么我们会对它进行物理治疗呢，还是什么其他操作？
Does your decision change if now that same 48-year-old male now has mechanical symptoms where his knee is getting stuck?
那么如果还是同样这个人，他现在出现了关节的这个症状机械症状，就卡压绞索的症状，那么你的决策会变化吗？
Or finally, does your treatment change? Instead of a 30-year-old or a 40-year-old, we have a 56-year-old woman who actually has more knee joint space narrowing, an extruded meniscus, and knee pain.
那么如果这时候我们的客户呢，她的年纪再大一些，变成了一个56岁的女性，那么她会伴有这个膝关节疼痛，但是呢没有绞索的症状，那么这时候我们的决策是什么呢？
So what I want you to pay attention here is what's the prevalence of meniscus tears in asymptomatic individuals.
好，那么这里我们来看一下，这是一个半月板撕裂的一个患病率的一个展示。
So what we can see is that in asymptomatic individuals between 50 and 59, they'll have MRI findings 20% of the time of a meniscus tear.
好，那么在美国的一些这个人群当中呢，我们会发现，在50到59岁呢，大约有这样一个比例的半月板撕裂的这个患病率20%以上。
When you're in your 60s, the incident rate goes up to 30 to 40%.
那么当我们到了60到69岁呢，这个患病率会达到30到40%。
And if you're in your 70s to 90s, the incidence of degenerative pathology on an MRI scan is almost 40 to 50%.
那么到了70岁以后呢，这个比例可能会在40%左右。
So just because we see it on an MRI scan does not mean it requires surgery or needs to be treated.
那么有时候这个患了这个半月板撕裂，它不一定非得去进行一些手术的恢复修复。
Now, this is probably one of the most influential articles that changed our thought in terms of how degenerative meniscus tears are treated. Because up until the time of this article, we would have done arthroscopy and trimmed all of the degenerative meniscus.
这里有一篇文章呢，它可能是一个非常知名的一个文章，它改变了我们的一些思考和想法。在这篇文章之前呢，可能我们只会通过关节镜去把这个患者的一些半月板摘除掉或者是修复掉。
So what Mosley did is they studied 180 patients and they compared a placebo or sham surgery to simple lavage as well as a debridement for degenerative meniscus tears and patients with osteoarthritis of the knee.
好，那么他们针对这些膝关节炎的这个患者180名患者进行了这个随机对照组的研究，他们分为了安慰剂组进行了这个 sham 手术然后呢进行了这个关节镜下灌洗组和关节镜下的这个切除组，然后看他们最终的这个效果。
And what they found is for early osteoarthritis of the knee, or when somebody has degenerative knee, that there's no difference in the outcome whether you do arthroscopy or you do nothing.
那么他们发现呢，对于这些早期的膝关节炎的患者，你给他做这个关节镜，或者说不做什么，最终的结果没有什么变化，没有什么差别。
Now, this study did not do an MRI scan, did not look at the type of meniscus tears, and did not assess mechanical pathology. It was focused on arthritis.
但是呢，这些研究有一些瑕疵，他没有做这个核磁共振的检测，他没有评估这个机械性的一些病理损伤。
But the study certainly challenged us that perhaps we were doing too much surgery.
但是这个研究呢，真正的挑战了我们常规的一些操作，很可能我们做了太多的手术，给没有必要的人进行了手术。
So this led to several additional studies asking similar questions. So this study now did a randomized controls trial. It was a slightly better quality study by Sandy Kirkley. It was published in the New England Journal of Medicine.
那么这是另外一篇这个新的这个研究它进一步探讨了这些安慰剂就非手术跟手术治疗的一些差别。那么这篇论文呢发表在了新英格兰杂志，这算是医学界非常非常著名的杂志。
Their patients had moderate to severe osteoarthritis.
那么这些患者呢，他们有这个中等或者严重的这个关节炎症。
and they found no additional benefit with arthroscopy when assessed by the WOMAC and SF36 patient-reported outcomes.
这里的 WOMAC 和 SF34啊，都是我们去评估膝关节疼痛的膝关节这个症状的一些问卷，大家在相关的网站上可以搜索到。那么研究显示呢，做不做关节镜啊，最后他们这些评分都没有什么变化，没有什么差别。
And when these articles started to come out, my orthopedic colleagues started to argue, well, maybe it doesn't work for arthritis, but if they have mechanical pathology, it's still an okay thing to do.
那么当我和我的这个同事啊，我的骨科的同事们看到这篇文章的时候呢，我们在讨论这个，虽然它可能对于这个实际的症状可能没有什么影响，但是呢，关节镜可能对于病理的损伤还是有帮助的。
And so this was another study now by Katz and Brophy, who looked at the comparison of surgery for meniscus tears with degenerative changes versus physical therapy.
好，那么这是有另外一篇新的研究，它会显示这个半月板撕裂的这个手术治疗啊和这个物理治疗的最终结果的差别。
And once again, they found very little difference in terms of patient-reported outcomes between physical therapy or arthroscopy.
好，那么最终呢，这样的一个研究结论也显示，物理治疗和手术治疗，就关节镜的手术治疗，它们最终的这个收益啊，效果也是没有什么差别的。
Now, there have been criticisms of some of these papers, but what we're seeing is a pattern over and over again that suggests that for basic degenerative arthritis and degenerative meniscus pathology, that jumping to arthroscopy is probably not the best choice.
虽然这些研究呢，它还有一些这个不同的意见或者是评价吧、评论、批评，但是呢，它都给我们提供了一种新的一种形式，就是很有可能呢，关节镜并不是一个最佳的处理手段。
This is a study that compared meniscectomy versus non-operative treatment. Once again, they found no significant difference in outcomes.
好，这是另外一个研究啊，它也是这个对比研究这个半月板切除术和非手术的治疗对于这个关节炎的一个影响，结果也是发现啊，各种关节功能的评分没什么差别。
And this study actually included patients with mechanical symptoms, and they still didn't see significant difference in outcomes.
而且呢，这个研究相对于前面的研究的优势在于，它做了一些机械性的症状的检测和核磁共振，而且在这方面也没有显示出任何差别。
This study was a 5-year follow-up comparing non-operative treatment and arthroscopy for degenerative meniscus tears. And at 5 years, they found that both improved, but there's no significant difference between either treatment.
好，那么这是另外一个研究啊，它跟踪随访了5年，在这个手术治疗啊，就关节镜和这个康复治疗之后啊，跟踪了5年，发现在5年之后呢，非手术治疗和手术治疗并没有明显的差别，效果没有差别。
This study actually did a sham arthroscopy and basically showed similar things. No significant outcomes between arthroscopy and no surgery at all.
OK， 那么这是另外一个这个研究啊，它显示了我们去进行一些假的手术啊，就是把患者麻醉了之后呢，做一堆这个操作，但其实什么都没做。另外呢是真正的这个半月板切除术，最后发现呢结果也是没有差异的。
So with all of those studies telling us not to jump to surgery, what should we do in terms of considering treatment of these?
那么既然这些研究
Go ahead.
那么既然这些研究都告诉我们，可能这个采用手术并不是一个好的这个操作，那么我们到底该怎么做呢？
In 2016, the European Society for Knee and Arthroscopy created a meniscus consensus statement.
那么这是2016年啊，这个欧洲的一些协会，他们对于这个半月板手术的一些建议。
Which helps guide our treatment.
它可以指导我们的一些治疗。
And basically what they suggest is that for a non-locked painful knee in somebody who's older than age 35,
那么这里建议，如果一个人他是没有一些绞索症状的这个疼痛的膝关节，然后他的年纪是35岁以上的，
and we're focused on a degenerative meniscus lesion,
那么我们可以进行下一步的这个一般的一些如果他没有这个膝关节的半月板的退行性疾病半月板退行性损伤，
the first best treatment is non-operative.
那么最佳的这个首选治疗呢，并不是手术。
Physical therapy, medications, and then finally, if that fails, then surgery is a reasonable option.
那么物理治疗吃药，那么可能是比最首先选择的这个治疗方法。如果最后没有效，那可能可以去采用手术。
Now, does that mean that surgery for degenerative meniscus tears doesn't work? And the answer is no.
但是这并不意味着手术治疗关节的退行性疾病呢，膝关节的退行性变呢是没有意义的啊。
We don't want to throw out the baby with the bathwater.
我们去倒洗澡水的时候，不会把孩子一起倒掉。虽然说这个手术治疗可能有一些选择上的这个把控的变化，但不意味着它没有意义。
Because meniscus surgery can be beneficial.
因为这个半月板的手术呢，可以是有益的。
These two studies from 2016 and from 2017 both show in patients who have symptomatic meniscus tears with mild degenerative changes that they can have significant positive outcomes.
那么这样两项研究呢，分别是2016年和2017年出现的，他们都显示了这些有半月板的损伤症状的这些人呢，他们通过手术可以获得非常明显的这个收益。
The key is that first we should try a non-operative course of treatment first. If that fails, then consider arthroscopy.
那么重点是我们首先要考虑一些非手术治疗，然后呢再去考虑手术治疗。
So with that said, we've talked about degenerative meniscus, we've talked about meniscus repairs. What is the next swing of the pendulum regarding meniscus treatment?
那么我们已经讨论了这些半月板的退行性疾病，讨论了半月板的修复。那么现在我们这个钟摆又摆到哪儿了？我们目前的挑战是什么？
And that is to answer the question, not whether we should take the meniscus out or whether we can save it, but the question is, if we've lost it, can we restore it?
那么现在问题已经不是说我们需不需要去切除它，我们怎么去修复它了？那么我们现在问题是我怎么样去恢复它？
And so the concept of restoration meniscus is really a little more futuristic. We're trying to find ways to re-provide the function that the meniscus provides, and we can do that with mesenchymal stem cells, meniscus scaffolds, or meniscus transplants.
那么重要的是，我们需要去重新找回半月板的功能我们可以用以下3种不同的东西去替代比如说骨髓间质干细胞半月板的支架和半月板移植。
And so for the next several minutes, I want to walk you through some of the pros and cons of these different treatments.
那么在接下来的几页 PPT 呢，我们来一起看一下这些不同的修复的方法。
Now, it's going to be very important as we look at these. Some of these are experimental, and not every swing of the pendulum will actually work.
那么要值得注意的是，后面分享的很多内容呢，他们都是在基础研究阶段，他们并不一定具有实践的效果。
So our options include biologic injections, scaffolds, as well as transplantation.
那么我们有这样不同的选择，包括这个注射这个支架，还有一些移植。
The concept of mesenchymal stem cells is really the concept that a central cell may de-differentiate and become what we want it to become, like chondrocytes or new meniscus, by squirting in these pluripotential cells.
OK，那么当我们讲到干细胞的时候，干细胞其实是一种核心的细胞，它能干嘛呢？它能够分化成我们所需要的所有的类型的细胞，比如说它可以分化成一些产生这个胶原的细胞。
In terms of what we know, is in terms of some positive impact, is that mesenchymal stem cells appear to have a positive effect when growing hyaline cartilage and articular cartilage.
好，那么这个间充质的干细胞呢，它对于我们的这个恢复啊，显示出了很多的这个优势的地方。
So all of these studies, which are relatively poor level of evidence, support the concept of mesenchymal stem cells with articular cartilage.
OK，那么我们这些大量的研究啊，在这里他们都显示了这个间充质干细胞，它们对于关节软骨的一些再生的帮助啊，当然它们证据等级呢不是特别的高。
But of course, this talk is talking about the meniscus. So the question is whether mesenchymal stem cells can help restore or regenerate meniscus.
OK，那么刚才这些研究呢都是关于这个软骨的，那么半月板呢是否能够通过同样的方式来修复？
And so there's been several studies, generally low evidence levels, that would support the use of mesenchymal stem cells for improving meniscus volume.
OK，那么这里有一些同样证据等级很低的研究，他们也显示出了这个间充质干细胞对于半月板的一些帮助。
This study from Centino, published in 2008, was one of the first that actually demonstrated, or at least suggested, improved meniscus volume based off of MRI imaging after mesenchymal stem cell injections.
那么这有一项研究啊，它显示了在膝关节中啊注射了骨髓的间充质干细胞之后呢，在核磁共振影像下，我们的半月板体积变大了。
Unfortunately, the quality of the evidence is poor. This was a singular case report, an unblinded interpretation of the MRI.
但是呢，这个研究报告啊，它有一些这个瑕疵有一些比较薄弱的地方。首先，它是一个单独的案例报告，案例报告。另外呢，它也不是一个盲性的研究啊。
A couple of other studies from from a different author, also very low evidence, have argued that mesenchymal stem cells can increase meniscal volume, but once again, there's small case reports and unblinded interpretations of the MRIs.
OK， 那么还有一些其他研究呢，也显示啊，似乎干细胞会有帮助，但他们的证据等级同样很低啊，也都是一些案例研究、案例报告，并且是非盲性的。就非盲性的就代表很可能会有作者的主观的这个倾向。
Pack, the same author as the last two, then followed 91 patients and noted that with mesenchymal stem cells, they did have an improvement in functional scores and a reduction in their pain.
OK， 那么同样是刚才两篇论文的作者，他进行了一个91个患者的新研究，会发现，进行了这个脂肪的相关的干细胞注射之后呢，这些患者的视觉疼痛量表，还有一些其他功能性的评分呢，还会有改善，疼痛也会有降低。
He did argue that they had increased meniscus regeneration based off of MRI.
那么通过核磁共振，他们展现出了这半月板的一些体积的增大再生。
But again, we have a problem that the images were unblinded and there were significant potential bias that he wanted to see more meniscus volume, and that may have been just his interpretation.
那么同样呢，这些研究的缺点在于，他们并不是一些非盲性的研究，作者可能会因为主观的这个影响的评判，影响到最终的结果。
This study, though, is actually a level 1 evidence study, so a very good evidence study from JBJS in 2014.
那么这里有一项2014年的研究啊，它是一个证据等级1级的这么一个研究，算是证据等级最高的研究。
And in this study, they actually showed improvement in pain, improvement in function, and increased meniscal volume with the mesenchymal stem cells.
那么这个研究显示了干细胞的注射呢，可以改善疼痛啊，改善这个功能评分，也能够增加半月板的体积。
So I believe this provides some evidence, or at least exciting possibilities, of a contribution of meniscus restoration with mesenchymal stem cells.
那么在这里呢，我相信干细胞对于膝关节的修复啊，半月板的修复，它是有一定帮助的。
Here you can see some example images where the authors would argue there's no meniscus present, and then after the mesenchymal stem cells, there's increased tissue within that same structure.
啊，从这个影像我们可以看到，在这个干细胞注射之前跟之后呢，我们这个会产生一些新的组织。这个黑的区域呢是一些新的半月板。
And here you can see a degenerative meniscus tear on one MRI scan, and then less intrasubstance degeneration post-injection.
OK， 那我们可以看到左边是注射前，右边是注射后。那么注射后呢，这些黑的区域呢是这个半月板的修复产生的。
Now, personally, I look at this and go, well, it's actually a different spin on the MRI. So there are different studies, perhaps different cuts. So I'm still waiting to be absolutely convinced that the mesenchymal stem cells make a difference.
OK， 那么但是呢，这个核磁共振啊，它并不能直接的去明确的显示半月板的修复，因为不同的机构、不同的设备它进行的这个切面不一样。那么所以说我还在观望啊，最终到底这个半月板的恢复到底是多少。
Nonetheless, I think that in terms of how the pendulum is swinging, it's a very exciting opportunity.
但是呢，这个我觉得这是一个非常令人振奋的一个帮助半月板修复的一个机会。
So if I'm going to grade mesenchymal stem cells, I'm going to say, has it proven that it reproduces function, prevents arthritis, or durable? We don't really have that support, but it is low risk and simple.
好，那么如果让我来评估一下这个间质干细胞治疗呢，在重建功能、预防关节炎和持久的这个效果方面，它都是不太行的。但是在低风险啊、操作简单上，它是很不错的。
So how about as a restoration mechanism, we actually insert some type of a device or scaffold to try to grow new meniscus?
那么我们可以通过这个置入一些半月板的支架，那么去恢复它的这些力学功能。
And there have been a few products and several papers supporting the use of collagen scaffolds.
那我们可以去使用一些这个胶原的一些材质啊，去置入。
And you can see with some of the drawings that basically you would find the gap of the meniscus tear, insert the scaffold, and then sew it into place.
那么我们可以从图上看到，我们需要去找到这个半月板撕裂的缝隙，然后把这个支架放到里面。
So let's see if actually there's been any support of this.
那我们来看一下有没有什么研究支持这样的操作。
Dr. Rodke with Ken DeHaven studied 157 acute and 154 chronic meniscus tears that they treated with an implant.
OK， 那么我们来看一下，这样几位研究者，他们找了157个急性半月板损伤和154例呢慢性半月板损伤，把它们随机分组，然后进行了这个支架的植入。
And what they found was improved meniscus volume.
那么他们最终发现了半月板的体积的增大。
And improved functional outcomes in the patients who had chronic meniscus tears, but had no improvement in function in patients who had acute meniscus tears.
那么在急性组呢，支架的植入对他们的功能恢复没有什么帮助，但是在慢性组，支架植入呢，有助于他们功能的改善。
So clearly for acutes, the better choice would be to attempt a repair. For chronics that you have meniscus loss, consideration of an implant or a scaffold may be a benefit.
所以呢，从结论上来看，对于急性的损伤来讲，他们可能更需要的是去修复手术， 而慢性组呢，他们如果有半月板的缺失，可以进行支架的植入，这可能有助于他们功能的恢复。
So a few other studies to support it. This is a study that had 33 patients with 10-year follow-up.
好，这是另外一个研究，参与的患者呢有33例，然后在术后跟踪随访了10年。
And at 10-year follow-up, they found improvement in pain scores, improvement in activity levels, and had better appearance on MRIs.
那么在10年后呢，他们的疼痛、他们的活动等级和他们的核磁共振结果呢都有所改善。
Or another study, again at 10-year follow-ups, that had satisfactory functional outcomes.
OK， 那么另外一个22例患者的10年跟踪随访研究他们有了一个令人满意的一个功能结果。
And probably the most important finding is that at 10-year follow-up, they had no medial joint space narrowing on X-ray.
那么最令人振奋的结果是在10年的跟踪随访之后 ，X 光显示他们并没有内侧关节间隙的狭窄。
Now again, it's a small number of patients. It's a level of evidence for study, but our goal here is to prevent arthritis, and this study would support that meniscus scaffolds have that potential.
那么虽然说这个研究的证据等级很低但是我们在这里的主要目的呢是探讨怎么去预防进一步的关节炎症的发生，而这样的一个研究结论呢显示了支架的植入的确有预防关节炎发生的可能。
Peter Verdonk used a different type of a meniscus scaffold. This is actually polyurethane instead of a collagen matrix.
OK， 那么这里呢有另外一位研究者，他进行了不同的支架材料的这个实验这个实验呢它其实本质上是属于聚氨酯。
But interestingly, even with this different type of scaffold, all patients at 3 months had significant clinical improvement.
那么即便他用了不同的材质不同材质的支架，但是呢3个月之后，所有的患者都显示出了一些显著的好转。
And here one had 18-patient study by Alan Getgood and others, again, all patients with clinical improvement.
这里有另外一项18名患者的研究，也是所有人都显示出了临床症状的好转。
Now, some of these studies may have bias, and some of these studies have low evidence quality. However, it does appear to be repetitive that the early studies of these scaffolds appears to be supportive of their use.
那么虽然说这些研究有些可能会有些偏移偏差，那么有些可能证据等级很低，那他们最终给我们提供了一个非常好的一个方向，就是半月板的这个支架植入对于总体的恢复是有帮助的。
This study actually by Dr. Rodkey, who has always been supportive of collagen scaffolds, actually did the analysis of all the previous studies, and he found 10 level 4 studies, 2 level 2 studies, 1 level 1 studies. And what he concluded was, as we've already made the assessment, most studies show improvement of meniscus tissues, most demonstrated improvement in clinical scores, and most demonstrated a slower progression of arthritis.
OK， 那么这里有另外一位研究者他写了一篇叫做 Systemic Review， 我们叫系统性综述，这就是总结性的文章。他统计了10篇证据等级4级、2篇证据等级2级、1篇证据等级1级的研究。那么综合了这些所有研究的结论呢，发现大多数研究显示，这个支架的植入呢，对于可以产生一些半月板样的组织，然后呢，这些患者的临床评分都有改善，他们患退行性关节性疾病的风险都会降低。
Now, as a critique of this article, any systematic review is only as good as its weakest level of evidence. So the level of evidence of this study is still level 4, but it does show a positive support of meniscus scaffolds.
那么这个系统性综述的证据等级通常会以它选用的这个最低证据的论文为主。那么所以说这个系统性综述虽然这个综述很厉害，但它证据等级依然很低，但它仍然给我们提供了一些非常非常 有意义的这个支撑啊，就是半月板的这个支架置入啊，可能是很有帮助的。
And then finally, I think regarding the scaffolds, this was a study that actually blended the last two things together. It was scaffolds that were injected with mesenchymal stem cells.
那么这里有一个研究呢，他把刚才的支架植入和间充质干细胞的注射呢，结合在了一起。
And in this study, the early follow-up at 2 years was good, but the later follow-up after 2 years had higher degrees of failures.
那么这个研究呢，在前2年会有很好的效果，那2年之后呢，效果就会明显下降。
So while I would have thought it was logical to put the two together, the outcomes here are pretty poor.
那么我想从逻辑上来讲，把这2个治疗方法合在一起呢，是不太合适的。
So what's our assessment of using synthetic scaffolds? It does appear to have some improvement in symptoms. It has some improvement in function. It may have some ability to decrease arthritis, but it's not proven. It's not proven regarding its durability, but it's relatively low risk.
OK， 那么总结一下，这个支架呢，它对于减轻症状有一些帮助，对于重建功能呢有些帮助，对于这个防止关节炎呢有些帮助，但是它可能不太持久啊。不过呢，这个它还是防止关节炎它缺少证据啊，缺少证据，那么不太持久。另外呢，它的确是低风险的、简单的。
So the last facet in terms of where is the meniscus potential for restoration is what is the potential outcomes of meniscus transplant.
那么我们最后呢，还有一种可能潜在的这个治疗手段啊，就是半月板的移植。
And is using a cadaveric meniscus as a transplant, is it better than the collagen scaffolds we've just talked about?
那么它会使用一种这个移植的这个材料呢，它可能会优于我们的合成材料。
In terms of techniques, there are various types of techniques in terms of creating a meniscus transplant, some that have bone plugs, some that have prepared slots.
那么可能我们会用一些这个自身身体的一些成分进行移植啊，比如说这个骨片啊 ，bone plug， 骨片进行移植。
In terms of the background of meniscus allograft transplantation, it was first performed in about 1980.
那么这个我们来了解一下半月板移植的这个背景啊，它第一次展现呢是在1980年。
And a meta-analysis that evaluated 26 years of meniscus allograft transplantation had several interesting findings.
那么在过去的20多年呢，我们会有一些比较有意思的研究进展。
They showed decreased pain at short and long-term follow-up.
那么在短期和长期的随访当中呢，患者显示出了疼痛的减轻。
Improved joint stability at short and long-term follow-up.
那么关节的稳定性在短期和长期随访中都显示出了增长改善。
Unfortunately, 60% had meniscus extrusion where they still weren't sitting between the femoral condyle and tibial plateau, so they weren't doing their job.
那么不幸的是，有60%呢会有半月板脱出的症状，就是移植物的脱出，他们可能没办法去完成他们的工作。
So there was a consensus group that evaluated meniscus transplantation.
那么我们来具体看一下什么样的一些人呢，他们可以考虑进行半月板的移植。
And based off of optimizing outcomes, they came up with several indications for when a meniscus transplant should be considered.
那么为了去达到一个最佳的一个结果，那么可能以下的一些状态，以下的一些适应症是适合做半月板移植的。
The classic is unicompartmental pain, in the presence of a total or subtotal meniscectomy.
那么如果它是有一些这个半月板啊，这个单侧的一些疼痛的啊，那这些可能可以考虑一下。
Actually, there's a slight favoritism to you doing a lateral meniscus transplant compared to the medial meniscus transplant.
啊，那么可能如果他们有一些这个外侧比内侧的这个结构会多一些这种状态呢，他们可能会引起平台的一些凹凸不平，那么可以进行这个半月板移植。
But either is an acceptable indication.
啊，但是呢，无论是哪一种适应症，
Another indication is that it can be a concomitant procedure at the time of an ACL revision if the purpose is to provide added joint stability.
好，那么另外呢，这个还有就是我们可以在这个前交叉韧带修复的手术当中呢，进行这个半月板的一些移植。
And this is because
啊，这是因为
Go ahead.
Sorry. 那么这样前交叉韧带的修复呢，为了增加关节的稳定性，可以进行这个半月板的一些移植。
And this is because the ACL protects the meniscus, but the meniscus protects the ACL.
啊，这是因为前交叉韧带保护着半月板，而半月板也保护着前交叉韧带。
It's also an important procedure that should be done concomitantly with an articular cartilage restoration procedure.
那么在半月板的这个缺损腔式的关节软骨修复的手术当中呢，啊，半月板的移植可能也是一个必备的操作。
Classic requirements for cartilage restoration include a good alignment, good stability, and an intact meniscus.
一个经典的软骨修复的要求是有良好的对线、良好的稳定性和完整的半月板。
If you don't have an intact meniscus or replace the meniscus, you'll get back to that focal load that increases the risk of arthritis.
那么如果你修复之后呢，这个半月板的状态并不好的话，那么就会有很大的这个核心压力，可能最终会引起关节炎。
It can also be done as a concomitant procedure with a high tibial osteotomy in a patient with a meniscus deficient knee who also has malalignment.
OK， 那么如果是半月板缺损的一个膝关节啊，它胫骨要进行一些高位截骨手术的话，也可以进行半月板的这个移植。
In fact, if you perform meniscus transplant and fail to address the alignment, you have a much poorer prognosis of the meniscus transplant procedure.
那么如果有这个高位的一些骨骼的骨折啊这样的患者，他们如果有明显的对线不良的话，如果不进行相关的操作，那么他们最后患这个关节炎的风险会很高。
In general, you should not perform a meniscus transplant prophylactically just because you've identified an athlete or a patient who's lost their meniscus.
那么我们并不能够直接就是去建议客户去这个常规的使用这个半月板的移植啊，因为它的证据等级比较低。
Now, this is an interesting challenge because we know that if a young person loses their meniscus, they will get arthritis within 10 years.
那么这是一个比较有意思的挑战，就是我们知道，如果一个人没有半月板的话，那么他很可能会在10年内患关节炎。
With that said, while the classic consensus is not to jump to a meniscus transplant, when we ask the experts, 16% of them actually said they would go ahead and in a young person that lost their meniscus would do a meniscus transplant early.
那么虽然说我们大家这个医学界呢都认为对于这个没有疼痛的人、没有症状的人，他们即便半月板缺损了，那么没有必要进行半月板移植，但是还是会有16%的专家说他们会进行半月板移植作为预防关节炎发生的这个手段。
For me, if I have a patient who's lost their meniscus, I won't do a meniscus transplant right away, but I educate them very carefully to tell them the first sign of pain or the first sign of problems because of loss of meniscus, then I will jump and do the meniscus transplant.
那么对于我来说呢，我通常不会直接给我的患者进行半月板的移植，但是我会跟他们沟通，教育他们，让他们了解什么是疼痛，什么是首先出现的这些疼痛症状。那么当他们意识到自己出现了症状之后呢，我们再进行这个半月板移植的治疗。
The contraindication to meniscus transplant is if significant arthritis is already present.
那么这里有一些这个不太适合进行这个半月板移植的一个症状，就比如说在这个不当的这些中度或重度的这个关节炎症的时候那么不适合进行半月板移植，因为移植之后呢，移植物存活的概率很低。
With moderate or severe arthritis, there's much poorer outcomes and decreased graft survivorship.
那么在中度或重度的关节炎的时候最终的预后会很差。
So in terms of technique, should we be using bone plugs, suture, a trough technique? There's actually no clear consensus about which of those is best.
那么我们现在呢，可能有一些这个骨栓缝合或者一些槽的这个技术去进行半月板的移植，但是并不知道哪种技术是最好的。
It's also unclear whether using biologic augmentation like mesenchymal stem cells at the same time as a meniscus transplant makes a difference.
那么我们也不清楚呢，运用一些干细胞或一些生长因子相关的这些操作来增加这个恢复是不是有用。
So only time will tell as we do more and better studies of which technique is the best and whether we should be augmenting with biologic materials.
那么只能交给时间等待出现更多的这个研究。
And now the last message I want to talk about in terms of meniscus transplant is when should you do them in athletes, and is it okay for them to return to sport?
那么这最后一个重点呢，我想跟大家讨论的是，我们是否需要在运动员身上做半月板的移植手术他们到底能不能够重返赛场？
And the traditional answer is no, they should wait till their career is over to have the meniscus transplant, and then hopefully that will give them a knee that they can depend on the rest of their life.
那么传统的答案呢，是等到他们职业生涯结束之后再进行一个半月板的移植手术，这样的话可以让他们在余生当中呢有一个可以使用的膝关节。
But with that said, Brian Cole and one of his fellows presented this paper of 13 patients who had meniscus transplants, and 77% in elite level athletes were able to return to play.
那么有这么一位研究者Brian， 他这个做了13例患者的这么一个研究，那么他们发现呢，这个跟踪了3年之后呢，77%的人能够成功的重返赛场。
So in terms of the evidence, there is unclear evidence regarding chondral protection.
那么这个讲到证据的话呢，我们看到这个证据等级呢也是比较低不够的。
And there may be poorer outcomes in the long term of high demand athletes who want to return to play.
那么在这个长期的饲养当中呢，一些这个高水平的运动员，他们可能也是比较缺乏这个证据的。
But in general, meniscus allograft transplants have improved pain and function both at short and long-term follow-ups.
那么总体上呢，这个半月板的移植手术呢是可以改善疼痛和恢复功能的。
So the general assessment of meniscus transplants is, does it eliminate symptoms? Not completely, but it's not bad.
好，那么最后来总结一下，半月板的移植呢，对于减轻症状虽然不能说特别好，但是还是有用的。
In terms of restoring function, it is the best we have right now. It's better than collagen scaffolds, and it's better than mesenchymal stem cells.
那么对于重建功能来讲，半月板移植是我们目前最好的办法，它是优于支架植入和干细胞注射的。
it does appear to delay the progression of arthritis, but because of meniscus extrusion, it does not absolutely prevent it.
那么半月板移植呢，的确可以防止关节炎、预防关节炎，但是它并不能完全预防关节炎。
It is a fairly complex surgery and a fairly expensive surgery.
那么这也是一个非常昂贵的手术。
We've talked about adding in biologics with the mesenchymal transplants, and you also want to optimize the rehabilitation for their success.
那么我们也希望通过康复手段呢，来更好的去恢复半月板的功能。
So, as we wind down this talk that covered meniscus transplants and meniscus meniscectomies and meniscus pathology, the question is how do you handle the pendulum of change as it relates to the meniscus?
那么我们已经讲了这么多半月板恢复相关的这个策略啊，那么我们该如何去掌控自己的这个中板？
First, we want to be open-minded. So don't hold absolutely true to the old dogma. Think about what's potentially best for your patient.
首先，我们要保持一个开放的心态啊，不要说以前的这个教条、以前的观点就是一定是对的。
When choosing the different alternative techniques, particularly in restoration or newer techniques, always fall back to primum non nocere. Don't make sure that your patient is always protected.
那么，无论我们在使用这个传统的策略还是新的策略的时候呢，首先保证第一点啊，就是不要给患者带来进一步的伤害。
When possible, carefully review the best evidence available, and so when you can use it, use level 1 and 2 evidence rather than level 4 evidence.
那么，当我们去进行选择的时候呢，要去综述啊，就是总概去阅读所有的这个证据啊，能选择证据1级的，就尽量不要选择证据4级的。
And as we do in most treatments and certainly all surgeries, we want to consider both the risks and the benefits to the patient when making those decisions.
那么，当我们去考虑为客户做出决定的时候呢，要综合权衡利弊。
So what do we know? We know that the meniscus is essential to load share and prevent arthritis.
那么我们现在已经知道了，半月板是非常必要的，去分担压力，然后去预防关节炎症。
We need to save and repair the functional meniscus at all costs.
那么我们需要尽一切可能去保护和修复具有功能的半月板。
Removing non-functional meniscus has no significant effect on the progression of arthritis because it was already a functional loss.
那么对于那些无功能的半月板组织呢，它们留不留下来啊，对于这个最终是否患关节炎没有什么影响，因为它们其实已经没有功能。
But when performing meniscectomies, you must always leave the functional remnants. Anything that's continuing to function, leave it in place.
那么最终有一个非常重要的一句话，叫做一定要留下残缺的功能。
In terms of degenerative meniscus tears, a non-surgical trial should be done first.
那么对于这些关节的退行性变，非手术方法应该是第一步。
Addressing mechanical pathology in a degenerative knee is still debated, but most arthroscopists would suggest if they have mechanical pathology to proceed with arthroscopy.
Sorry, last sentence I did not hear.
When addressing mechanical pathology or a locking knee, there is still some debate, but most arthroscopists would still suggest surgery if there's a mechanical pathology.
OK， 对于有这个机械性损伤的，还有这个有绞索症状的人呢，他们到底该怎么治疗啊？仍然是这个有争议的，但是可能还是倾向于进行手术治疗。
Meniscus restoration tools such as mesenchymal stem cells and scaffolds are supported, but only by low-quality evidence.
那么半月板的一些修复，包括干细胞和支架植物呢，可能有效，但它们只有一些低等级的证据的支持。
And meniscus transplants, when you meet specific indications, appear to be effective in select populations.
那半月板移植在某些人群当中呢，可能也是有效。
With that, I hope you've learned a little or a lot about meniscus. I thank you for your attention and challenge you to keep answering the question of where you are on the pendulum so that you can keep moving forward in caring for meniscus injuries.
好，那么通过今天的课程呢，我希望大家对于半月板的损伤获得了一些了解。那么你在这个钟摆当中到底现在是在一个什么位置？谢谢大家的这个关注。
I thank you very much for your attention, and I thank my translator for making me sound good.
谢谢大家的这个时间关注，也感谢我的翻译。Thank you.
Thank you.